Hi, I'm Dr. Vishnu Gade, consultant psychiatrist at Arete Hospitals, Hyderabad. So today I wanted to talk a topic about weed usage or cannabis intoxication, the signs and symptoms that the parents need to have an idea about, because due to the increase in drug usage from the past few years, the criteria which people used to start or given to trying the new substances has drastically come down. From my experience professionally, I used to see the first time users would be around 21, 22 years of age, but now for certain reasons, maybe peer pressure or easy availability of the substance, kids as young as 15 or 16 are also experimenting with cannabis for the first time. So the risk factors increase drastically because of such a young age when the child's brain is exposed to said drugs such as marijuana, cannabis. So what the parents can do or keep an eye on is, because a lot of parents ask me, doctor, how do I know that my child, when he comes back home, how do I identify that he is high or slash taken the substance? Because with alcohol, as you know, we can smell the drink of the person's breath or body or clothes, or with smoke we can smell the cigarette smell, but with weed it may be masked better. So a lot of parents ask me, doctor, how do I identify that my child has taken the substance when they are doubtful? So the signs and symptoms for marijuana intoxication starts with redness of the eyes, watery, and the person, boy or girl, will be sluggish, the movements will be slow, coordination will also be sluggish, there will be increased laughing by the person. The person may also have an increased appetite, which we call the munchies, and there will be an increased craving for sweets and liquids, especially juices or cool drinks. The next thing will be he enjoys dancing a lot to music, he might enjoy playing games, but they might be decreased in psychomotor activity, reduced movements. The patient might want to sit in one place rather than move a lot. There will be decreased social interaction also, and then the cognitive picture is also seen where the person's memory is affected. It is not as drastic as the alcoholic blackouts, but yes, there might be forgetfulness, there might be confusion a little bit seen. So as long as the patient takes limited quantities, these signs are not that bad, but if the patient takes 2, 3 or more 4 joints, it becomes very high intoxication, and all these signs that we have discussed become very, very easily visible. The next thing that we as psychiatrists do worry about is marijuana addiction, and that also might have underlying primary causes such as depression, anxiety, etc. And also the patient might be taking other substances, for example alcohol, cigarettes, etc., and other high-end drugs such as stimulants too. So we need to do a tox screen urine analysis test to find out what substances the patient has taken, and based on that report we can start off the psychotherapy and also medications if needed. Recently what has been rising is marijuana psychosis or weed psychosis. Due to the maybe quality of the weed or intake in the high intake of quantity of the weed, the patient's dopamine levels are getting damaged, and there is a lot of neurochemical imbalance that is happening in the brain in these patients, and thus psychosis is also seen, where the patient may have severe hallucinations, panic attacks, anxiety, and delusionary behavior or persecutory behavior. And when the drug is stopped, the patient might also have weed withdrawal symptoms, which is very akin to other things which is cigarettes, such as physiological dependence, psychological dependence, etc. So these are the telltale signs that the parents can keep an eye on if they suspect their child is taking any such illicit drug, and when they do, they can bring the patient to the hospital where we can do our interviews and analysis, and we can formulate a proper treatment chart for the child. Thank you.